Hello everyone, my name is CLARETTA BELLAMY and this video will be part 2 of my coronavirus series. Also called COVID-19, the coronavirus is a current worldwide pandemic. As of right now, there are over 3.5 million cases worldwide, with over 1.2 million cases being in the United States. Although anyone can contract the virus, it seems that the elderly population and those with underlying health conditions are more at risk for developing severe illness, which may lead to death. Race is also a factor as well. According to the Surgeon General, African Americans are at higher risk for contracting COVID-19 due to factors such as socioeconomic status and pre-existing health conditions such as diabetes and heart disease that is common amongst that community. Today, I'm going to talk with Patricia Way, a woman who contracted the coronavirus and has survived, to share her story and tell us just how real this virus is. Hi Patricia, thank you for agreeing to sit with me today.
Oh, you're welcome. Thank you for asking.
So if you can, for me, can you just go back and give me a timeline of exact dates when you first came in contact with the neighbors who had COVID-19, the date and time frame they passed away, when you got tested, and when you found out you were positive?
I first came into contact with my neighbors on Wednesday, April 1st. Also on April 2nd, I was assisting them, and it required physical contact. That Friday, April 3rd, they were taken to the hospital. On that Saturday, I was advised that they had the COVID virus. On that Saturday night, I experienced that one cough in the middle of the night. I was advised Sunday evening, that my neighbors actually succumbed to the virus, and they both passed away. It was a married couple, aged 96 and 88. On April 6th, I went and I had the test. By Wednesday evening, the 8th, I received a call advising that I tested positive for the virus. When I did go to have the testing done, they had taken my temperature, they had checked my lungs, everything was fine. There was nothing visible about me that said I was ill. There was very little that I was feeling that would make me think I was ill, other than a little bit of body aches that you get that's sometimes associated with the flu. I did have on the gear. I had on gloves and I had on a mask.
During the time when you had the virus, did the thought ever come across your head that I might lose my life?
Yeah, it did. And I had a talk with God, I'm not ready for that just yet. There are things that I have left undone and things that I have to do. And that said, just please give me the opportunity to do that. My son had lost his dad last year in 2019. And that was a hard thought for me, to have him lose his mom and dad, like a year apart. That would have been sad to me, and I just didn't want that for him.
You mentioned something interesting, that while you were helping your neighbors and you were wearing the protective equipment such as gloves and a mask, you still acquired the virus. So do you really think masks actually work?
They have some benefit, but I can't say that that's 100%. It's more like 12 to 15 feet that you need to really be away, because these particles linger in the air for a couple of minutes. Being a diabetic, I knew that I ran a risk, but that's not something you think about. You're just trying to help people. But for my mother, I want somebody to help her. I didn't feel like I was sick. And even afterwards, I didn't feel like I was sick. But yet I'm very sick.
What advice would you give to others who may think that they have COVID-19?
Go get tested and demand to be tested. There's no reason why anybody should not test you. Being under a doctor's care, going and getting regular checkups and things that you should. Women getting your checkups, men getting your checkups, whether they're annual, whether they're every 10 years, whatever it is that you're supposed to do, so that you at least have an idea of your own medical history, and someone also has information on you. It makes a difference. To get sick could be a big deal for me. If I catch a cold, I may wind up in the hospital. Why not with corona? I don't know.
How would you feel if your test results came back that you were still positive for COVID-19?
I would feel that this information needs to be documented. That, okay, we have this person of a certain age, ethnicity, health, concerns, and this is her situation now. I mean, we live in Jersey. It's the pharmaceutical capital of the country. I refuse to believe you can't make necessary tests available for whomever and how often they may need it. If they tell me that I no longer have, the virus in me, which that's what my hope is, that is there something that I can do? Are my antibodies something that would be of benefit? The big deal is once you know that you have it, you just don't want to infect anybody else. I have been quarantined since March 23rd. Tomorrow will be a month when I was first tested. So that's why I plan on going and seeking to get retested.
How are you feeling right now? Are you feeling any better?
Oh, I feel fine. I truly do. But the atmosphere of others is something that I'm totally without because I'm locked in. My son, he had a birthday on April 18th. Wasn't able to, share in any of that. And I wasn't even able to go get him a card. The part about not being free to move about as I want to, that's the hard part of it all.
Thank you so much for sitting down and talking with me about your experience of having COVID-19. I'm so glad that you were able to get through it. And I'm hoping that your test results from tomorrow will come back.
Yes. That's what I'm hoping for. Thank you so much.